Hi friends, welcome to the channel Nursing Coach. Today we are going to discuss about few multiple choice questions which are very important for NORCET exam. The given question is, what is the primary site of hematopoiesis in an adult? The given options are bone marrow, liver, spleen and all of the above. What is hematopoiesis? Hematopoiesis means blood cell productions. Means, according to the question, from which site primarily in an adult the blood cells are produced? So the correct answer is bone marrow. Liver and spleen are not the primary sites of hematopoiesis because liver and spleen will produce the blood cell production when bone marrow fails to produce the blood cells. So liver and spleen are considered as extramedullary hematopoietic organs. Next question. What are the extramedullary hematopoietic sites in the body? Options are liver, spleen, bone marrow, both A and B. As we discussed in the above question, the extramedullary hematopoietic organs are liver and spleen. Bone marrow is the primary site of hematopoietic organ. So the correct option is option D. Next question. What are the self-replicating cells in the bone marrow? The given options are RBC, WBC, stem cells, platelets. Self-replicating cells means they can reproduce on their own. So, according to the given options, RBC, WBC and platelets are not self-replicating organs, self-replicating cells, because these three cells are formed from the or differentiated from the stem cells only. The correct option is stem cells. So the stem cells are the self-replicating cells, or they are also called as primitive cells. Next question. In a bone marrow, the stem cells differentiate into which cells? Option A RBC, option B monocytes, option C myeloid or myeloid lymphoid cells, option D plasma cells. So according to the given question, stem cells differentiate into two types of cells. One is myeloid stem cells and lymphoid stem cells. From myeloid stem cells, RBC, WBC and platelets are formed, and from lymphoid stem cells, T lymphocytes, B lymphocytes are formed. From B lymphocytes, Again, B lymphocytes are differentiated into plasma cells. So the correct option is myeloid stem cells or lymphoid stem cells. The other options are formed from the myeloid and lymphoid cells only. Next question. Myeloid stem cells differentiate into which cells? The given options are RBC, WBC, platelets, and D, all of the above. So here we can see myeloid stem cells are differentiated into RBC, WBC, and platelets. So the correct option is all of the above. Next question. Lymphoid stem cells differentiate into which cells? Option A, T lymphocytes. Option B, B lymphocytes. Option C, plasma cells. Option D, both A and B. As we discussed in the previous questions, lymphoid stem cells are differentiated into T lymphocytes and B lymphocytes. So, in the given options, T lymphocytes are there, B lymphocytes are there. The correct option is both A and B. Plasma cells are differentiated from B lymphocytes. Next question. Which of the following is the mature form of B lymphocytes? The given options are stem cells, plasma cells, B lymphocytes, T lymphocytes. B lymphocytes differentiates into plasma cells. So the correct option is option B. These plasma cells forms the immunoglobulins or antibodies. This plasma cell is considered as the mature form of B lymphocytes. The other options are C and D are the differentiation of lymphoid stem cells. Lymphoid stem cells. Option 1 is not correct. Next question. Which cells are responsible for cell-mediated immunity? The given options are B lymphocytes, T lymphocytes, plasma cells, WBC. Here, cell-mediated immunity means that these cells are integral part of these cells are integral part of immunity. So, as we know that stem cells are differentiated into myeloid stem cells, and lymphoid stem cells. These lymphoid stem cells are again differentiated into T lymphocytes, B lymphocytes. So these T lymphocytes are responsible for the cell mediated immunity, and B lymphocytes are responsible for humoral immunity. So the given options like B lymphocytes and plasma cells belongs to humoral immunity, and WBC belongs to or which are differentiated from myeloid stem cells. These WBC will fight against infection. So the correct option is option B, T lymphocytes. Next question. What are granulocytes? The given options are A. Neutrophils, B. Basophils, C. Eosinophils, option D. All of the above. So granulocytes are with nuclei. These granulocytes are a type of WBC. These WBC consists of neutrophils, basophils, eosinophils. All these three cells are granulocytes. So the correct option is all of the above. Next question. What are the hemopoietic sites in an adult? The given option is pelvis, sternum, vertebrae, ribs, all of the above. So here in an adult, the hemopoietic sites are pelvis, sternum, ribs, and vertebrae. In children or in child age, all skeletal muscles are involved in hemopoiesis. When the child grows, gradually the hemopoiesis is restricted to some parts of body like pelvis, sternum, ribs, and vertebra. So the correct option is all of the above. Next question. What are the hemopoietic blood cell formation sites in children? The given options are all skeletal muscles, option B liver, option C spleen, option D all of the above. As we discussed in the above question, in children all skeletal muscles are involved in the hemopoiesis. The correct option is option A. Liver and spleen are extramedullary hemopoietic organs. These organs will if produce blood cells if bone marrow is affected. Means if a client is having a disease which involves the bone marrow, like bone marrow fibrosis, bone marrow scarring, etc. Next questions. What are the primitive cells in the bone marrow? Option A, stem cells. Option B, plasma cells. Option C, lymphocytes. Option D, all of the above. The correct option is stem cells. Stem cells are the primitive cells in the bone marrow. These are present within the bone marrow. They will reproduce stem cells on their own. Plasma cells, lymphocytes, these are formed from the stem cells only. So the correct option is option A. Next question. How many components does the bone marrow divided? The given options are 1, 2, 3 and 4. The correct option is two components. One is red marrow and the other is yellow marrow. Red marrow is a cellular component which involves in the production of cells, and yellow marrow is a fat component. These cellular components are distributed like islands in the bone marrow, which are separated by fat fat component. So the correct option is option B. Next question. If a myeloid stem cells got affected in the bone marrow, what are the cells that are going to be affected? The correct option is option A, WBC. Sorry, the given options are option A, WBC, option B, RBC, option C, platelets, option D, all of the above. So according to the given question, which cells got affected in the bone marrow if myeloid cells had affected? So myeloid stem cells produce RBC, WBC and platelets. So the correct option is all of the above, because myeloid stem cells are differentiated into RBC, WBC, platelets. Suppose if there is a problem in myeloid stem cells, whole RBC, WBC and platelets also got affected. Next question. Option A. Immunoglobulins or antibodies are produced by which type of immunity? Option A. Cell mediated immunity. Option B. Humoral immunity. Option C. Phagocytosis. Option D. None of the above. So the first option is cell mediated immunity. It is done by T lymphocytes, and the humoral immunity is done by B lymphocytes. From B lymphocytes, plasma cells are formed. From plasma cells, immunoglobulins or antibodies are produced. And phagocytosis means the cells will attack the foreign body and digest it. So it doesn't relate to the given question. So the correct option is option B, humoral immunity. Thank you for watching the video. If you like the video, please like, share and subscribe the channel.